Today, a silent epidemic is sweeping across the globe, largely unnoticed yet profoundly impactful. It's not a virus nor a bacterium, but a collection of conditions that develop slowly, insidiously, often without immediate, obvious symptoms. This epidemic doesn't make headlines with daily infection rates, but its consequences are far-reaching and devastating, is unfolding inside our bodies within our very cells, tissues, and organs. It's a slow burn, a gradual deterioration that often goes undetected until significant damage has already occurred. These conditions are not contagious in the traditional sense, but they are pervasive, affecting individuals from all walks of life, regardless of age, gender, or socioeconomic status. We're talking about non-communicable diseases, or NCDs. These diseases represent a significant and growing threat to global health, placing immense strain on healthcare systems and economies worldwide. Understanding what they are, how they develop, and what we can do to prevent and manage them is crucial for safeguarding our collective well-being. These chronic conditions, unlike acute illnesses that strike suddenly and resolve relatively quickly, linger for extended periods, often a lifetime. They require ongoing medical attention, lifestyle adjustments, and a commitment to self-management. The burden they place on individuals, families, and healthcare systems is substantial and multifaceted. Consider heart disease, a leading cause of death globally. It encompasses a range of conditions from coronary artery disease to heart failure, all of which impair the heart's ability to function effectively. These conditions often develop over years, fueled by factors such as high blood pressure, high cholesterol, and unhealthy lifestyle choices. Then there's cancer, a complex group of diseases characterized by the uncontrolled growth and spread of abnormal cells. Cancer can affect virtually any part of the body, and its treatment often involves a combination of surgery, chemotherapy, and radiation therapy. Early detection and prevention are key to improving outcomes for cancer patients. We also face the growing challenge of diabetes, a metabolic disorder characterized by elevated blood sugar levels. Diabetes can lead to a host of complications, including heart disease, kidney disease, nerve damage, and blindness. Managing diabetes requires careful monitoring of blood sugar levels, dietary modifications, and in some cases, medication or insulin injections. And let's not forget chronic lung diseases, such as chronic obstructive pulmonary disease, COPD, and asthma. These conditions make it difficult to breathe, limiting physical activity and impacting quality of life. Exposure to tobacco smoke, air pollution, and other environmental irritants can contribute to the development and progression of chronic lung diseases. These NCDs and others are now the world's leading cause of death, surpassing infectious diseases as the primary threat to human health. This shift reflects changes in lifestyle, diet, and environmental factors, as well as advancements in medical care that have extended lifespans. Unlike infectious diseases, which are caused by pathogens and can spread rapidly from person to person, NCDs are not contagious. You can't catch heart disease or diabetes from someone who has it. This fundamental difference has significant implications for how we approach prevention and control. NCDs don't spread from person to person through direct contact or airborne transmission. They are not the result of a single infectious agent invading the body. Instead, they arise from a complex interplay of factors that accumulate over time. Instead, they develop over years, even decades, often without noticeable symptoms in the early stages. This slow, insidious progression makes early detection and intervention challenging, but all the more crucial. By the time symptoms appear, significant damage may have already occurred. The development of NCDs is driven by a complex combination of genetics, environmental factors, and lifestyle choices. Our genes can predispose us to certain conditions, while our environment exposes us to risk factors such as pollution and toxins. However, lifestyle choices such as diet, exercise, and smoking play a particularly significant role. You can't catch diabetes from a friend or family member. It's not transmitted through physical contact or shared utensils. The development of type 2 diabetes, the most common form of the disease, is strongly linked to lifestyle factors such as obesity, physical inactivity, and unhealthy eating habits. But shared habits and environments put us all at risk. If a family consistently consumes processed foods, engages in little physical activity, and lives in an area with high levels of air pollution, all members are at increased risk of developing NCDs. This highlights the importance of creating healthy environments and promoting healthy behaviors at the community level. The numbers are staggering, painting a stark picture of the global burden of NCDs. These diseases are not just a problem for individuals, they are a major public health crisis that demands urgent attention and concerted action. NCDs cause over 70% of global deaths each year, a figure that underscores the immense scale of this challenge. This means that out of every 10 deaths worldwide, 7 are attributable to NCDs. This is a dramatic increase from previous decades, reflecting the growing impact of these conditions on global health. That translates to over 41 million lives lost annually to these preventable and treatable conditions. Each of these deaths represents a personal tragedy, leaving behind grieving families and communities. The human cost of NCDs is immeasurable. Nearly 17 million of these deaths are premature, occurring before the age of 70. This is particularly concerning because it means that many people are dying in their prime, before they have had the chance to live full and productive lives. This is striking people under 70, robbing them of years of life and contributing to significant economic losses. Premature deaths from NCDs not only cause immense suffering, but also reduce the workforce and productivity of nations. While NCDs are a global problem, this isn't just a problem for wealthy countries with advanced healthcare systems. In fact, the burden of NCDs is disproportionately high in low and middle-income countries. Low and middle-income nations are hit hardest, lacking the resources and infrastructure to effectively prevent, diagnose, and treat these conditions. This disparity exacerbates existing inequalities and hinders economic development. In the following sections, we'll explore the main types of NCDs, delving into their specific characteristics and risk factors. We'll examine the 4 major categories: cardiovascular diseases, cancers, chronic respiratory diseases, and diabetes. We'll also investigate what's driving their rise, examining the underlying factors that contribute to the increasing prevalence of NCDs worldwide. These factors include aging populations, urbanization, globalization, and changes in lifestyle and dietary habits. Furthermore, we'll analyze the toll they take, both in terms of human suffering and economic costs. NCDs place a significant burden on healthcare systems, reduce productivity, and contribute to poverty. We'll also discuss the impact on families and societies, highlighting the social and economic consequences of NCDs. These diseases can strain family relationships, reduce household income, and limit opportunities for education and employment. But most importantly, we won't just focus on the problems. We'll look at what's being done at the global, national, and local levels to combat NCDs, showcasing successful interventions and innovative approaches. These efforts include public health campaigns, policy changes, and advancements in medical research and treatment. And crucially, what you can do as an individual to protect yourself and your loved ones. We'll provide practical tips and strategies for adopting a healthy lifestyle, reducing your risk factors, and advocating for change in your community. Together, we can fight back against this silent epidemic and create a healthier future for all. By taking action and making informed choices, we can reduce our risk of developing NCDs and improve our overall well-being. Understanding NCDs is the first step towards taking control of your health and well-being. Knowledge is power, and by learning about these diseases, their risk factors, and prevention strategies, you can make informed decisions that will benefit you and your family. It's the first step to protecting our health and future, ensuring that we can live longer, healthier, and more fulfilling lives. By prioritizing prevention and early detection, we can reduce the burden of NCDs and create a brighter future for generations to come. So let's dive in and begin our journey to understanding and addressing the global challenge of non-communicable diseases. It's time to take action and make a difference in the fight against NCDs. Let's confront this global challenge together, working collaboratively to promote health, prevent disease, and improve the lives of people around the world. By uniting our efforts, we can make significant progress in reducing the burden of NCDs and creating a healthier planet for all. The conversation starts now, and your participation is essential. Let's work together to raise awareness, promote prevention, and advocate for policies that support healthy lifestyles and reduce the burden of NCDs. Why are NCDs surging worldwide? The answer lies in how we live today. Urbanization means more people are sedentary, eating processed foods high in salt, sugar, and unhealthy fats. As we live longer, age-related diseases like heart failure and cancer become more common. Air pollution and tobacco exposure further increase risk, especially in cities. Genetics play a role, but lifestyle and environment are key drivers. Many health systems aren't equipped for long-term care, and late diagnoses make treatment harder and costlier. The result? A perfect storm for chronic disease, especially in poorer regions with limited healthcare access. Tackling these root causes is essential for turning the tide. Now let's take a closer look. Let's break down the complex world of non-communicable diseases, or NCDs, to better understand their impact on global health. We'll explore the major categories, the risk factors that contribute to their development, and the strategies we can employ to prevent and manage them effectively. This deeper dive will provide valuable insights into how we can collectively work towards reducing the burden of these diseases and improving the overall well-being of communities worldwide. It's crucial to understand these diseases, not just as medical conditions, but as challenges that require a multifaceted approach involving individuals, healthcare systems, and policymakers. The 4 main NCDs that are causing the most harm globally. These are the heavy hitters, the conditions that contribute most significantly to illness, disability, and premature death across the world. Understanding these 4 categories is the first step in addressing the global NCD crisis. We need to know what we're up against to develop effective strategies for prevention and treatment. These diseases are causing the most harm, placing immense strain on healthcare systems and impacting countless lives. The sheer scale of their impact demands our attention and concerted action. We must recognize the urgency of the situation and work together to mitigate the devastating consequences of these widespread health challenges. First, we have cardiovascular diseases, a broad category encompassing a range of conditions affecting the heart and blood vessels. These diseases are a leading cause of death worldwide, and their impact is felt across all demographics. This includes heart attacks, sudden and often devastating events that occur when blood flow to the heart is blocked. Heart attacks can lead to permanent heart damage and even death if not treated promptly. Recognizing the symptoms and seeking immediate medical attention are crucial for survival. Strokes, which occur when blood supply to the brain is interrupted, causing brain damage. Strokes can result in a wide range of disabilities, affecting movement, speech, and cognitive function. Rehabilitation is often a long and challenging process, requiring intensive therapy and support. And high blood pressure, a silent killer that often goes undetected, silently damaging the heart and blood vessels over time. High blood pressure significantly increases the risk of heart attack, stroke, and kidney disease. Regular monitoring and lifestyle modifications are essential for managing this condition. These cardiovascular ailments are the top killers globally, responsible for a significant proportion of deaths each year. The impact of these diseases is felt across all age groups and socioeconomic levels. These conditions are often fueled by smoking, a major risk factor that damages blood vessels and increases the risk of blood clots. Smoking is a leading cause of preventable death worldwide, and quitting is one of the best things you can do for your health. Inactivity, a sedentary lifestyle that contributes to weight gain, high blood pressure, and other risk factors. Regular physical activity is essential for maintaining cardiovascular health and reducing the risk of chronic diseases. And poor diet, characterized by high levels of saturated fat, salt, and sugar, which can lead to high cholesterol, high blood pressure, and obesity. A healthy diet rich in fruits, vegetables, and whole grains is crucial for preventing cardiovascular disease. Cancer comes next, a complex group of diseases characterized by uncontrolled cell growth. Cancer can affect any part of the body and is a leading cause of death worldwide, with lung cancer often linked to smoking and exposure to environmental toxins. Lung cancer is one of the deadliest forms of cancer, with a low survival rate. Breast cancer, a common cancer among women, but also affecting men. Early detection through screening is crucial for improving survival rates. And colorectal cancers, which are often preventable through screening and lifestyle modifications. Regular colonoscopies are recommended for individuals over a certain age to detect and remove precancerous polyps. These are the most common types of cancer, but many other forms exist, each with its own unique characteristics and treatment approaches. Cancer is a complex and challenging disease, but advances in research and treatment are constantly improving outcomes. Causes of cancer include genetics, inherited predispositions that increase the risk of developing certain cancers. Genetic testing can help identify individuals at higher risk, allowing for earlier screening and preventive measures. Tobacco use, a leading cause of lung cancer and other cancers. Quitting smoking is one of the most effective ways to reduce your risk of developing cancer. And environmental exposures such as pollution and radiation, which can damage DNA and increase the risk of cancer. Reducing exposure to these environmental hazards is crucial for cancer prevention. Chronic respiratory diseases, a group of conditions affecting the lungs and airways. These diseases can make it difficult to breathe and can significantly impact quality of life. Conditions like COPD or chronic obstructive pulmonary disease, a progressive lung disease that makes it difficult to breathe. COPD is often caused by smoking and can lead to severe disability and death. And asthma, a chronic inflammatory disease of the airways that causes wheezing, coughing, and shortness of breath. Asthma can be triggered by allergens, irritants, and exercise. These respiratory illnesses are often driven by tobacco smoke, both direct and secondhand. Avoiding exposure to tobacco smoke is crucial for preventing and managing these conditions. And air pollution, which irritates the lungs and airways, exacerbating respiratory symptoms. Reducing air pollution is essential for protecting respiratory health. Finally, diabetes, especially type 2, a metabolic disorder characterized by high blood sugar levels. Type 2 diabetes is the most common form of diabetes and is often preventable through lifestyle modifications. Diabetes is strongly linked to obesity, which increases insulin resistance and the risk of developing the disease. Maintaining a healthy weight is crucial for preventing type 2 diabetes, and inactivity, which contributes to weight gain and insulin resistance. Regular physical activity helps improve insulin sensitivity and lower blood sugar levels. Over time, diabetes damages organs, including the heart, kidneys, eyes, and nerves. Managing blood sugar levels through diet, exercise, and medication is essential for preventing these complications. The good news is that prevention is possible. We can take steps to reduce our risk of developing these NCDs. This starts with healthy eating, consuming a balanced diet rich in fruits, vegetables, and whole grains. Regular activity, engaging in at least 30 minutes of moderate intensity exercise most days of the week, and avoiding tobacco in all its forms, eliminating a major risk factor for many NCDs. These lifestyle changes make a huge difference in reducing your risk and improving your overall health. Early detection through regular screenings is also crucial for identifying and treating NCDs in their early stages. And proper management of existing conditions can help prevent complications and improve quality of life. Early diagnosis and effective treatment save lives, reducing the burden of these diseases. However, access to quality care remains unequal, with many people lacking access to the resources they need. These healthcare disparities contribute to poorer outcomes and exacerbate the burden of NCDs. Innovations in treatment are constantly emerging, offering new hope for those living with NCDs. These advancements are helping to improve outcomes and extend lives. But ultimately, prevention is the most powerful tool we have in the fight against NCDs. Prevention is still our best weapon, empowering individuals and communities to take control of their health. These 4 NCDs, cardiovascular diseases, cancer, chronic respiratory diseases, and diabetes, account for the vast majority of preventable illnesses and premature deaths worldwide. They represent a global health crisis that demands urgent action and sustained commitment. Understanding them, their risk factors, and the strategies for prevention and management is key to fighting back and creating a healthier future for all. By working together, we can reduce the burden of NCDs and improve the lives of millions around the world. The fight against NCDs is a global imperative, requiring collaboration, innovation, and a commitment to health equity. NCDs don't just harm individuals, they ripple through families, economies, and societies. Chronic illness drains national budgets and shrinks the workforce, especially when working-age adults get sick or die early. Families face financial ruin from medical bills and lost income, often forcing loved ones to become caregivers. The burden falls hardest on poorer communities, deepening cycles of poverty and inequality. Social networks weaken as illness isolates people and limits community participation. NCDs widen the health gap between rich and poor, undermining social justice. Addressing NCDs isn't just about health. It's about building stronger, fairer societies. The stakes are high for everyone. Across the globe, a powerful movement is building. People from all walks of life are rising up, demanding change and advocating for healthier lives. They are no longer willing to stand by as non-communicable diseases, or NCDs, continue to claim millions of lives each year. This is a fight for our future, a fight for the well-being of generations to come. The world is fighting back against NCDs with bold strategies, innovative policies, and a renewed commitment to prevention and control. Governments, international organizations, and healthcare professionals are collaborating to develop and implement comprehensive plans that address the root causes of these diseases. These strategies are designed to create healthier environments, promote healthy behaviors, and ensure access to quality healthcare for all. The World Health Organization's Global Action Plan serves as a roadmap for countries to tackle NCDs effectively. This plan outlines a series of evidence-based interventions and targets that aim to reduce the burden of these diseases worldwide. It emphasizes the importance of multi-sectoral collaboration, engaging all stakeholders in the fight against NCDs. This ambitious plan targets a 25% reduction in premature NCD deaths by 2025. This is not just a statistic. It represents millions of lives saved, families spared from grief, and communities empowered to thrive. Achieving this target requires a concerted effort from all nations, working together to implement effective prevention and treatment strategies. To achieve this goal, best buys include tobacco taxes, which discourage smoking and generate revenue for health programs. By increasing the cost of tobacco products, governments can reduce consumption and protect their citizens from the harmful effects of smoking. Salt reduction in processed foods and public awareness campaigns to encourage healthier eating habits. Reducing salt intake can significantly lower blood pressure and reduce the risk of heart disease and stroke. Banning trans fats from the food supply, a simple yet effective measure to protect cardiovascular health. Trans fats are known to raise bad cholesterol levels and increase the risk of heart disease, making their elimination a crucial step in promoting public health. And promoting physical activity through accessible and affordable programs and infrastructure. Encouraging people to be more active can help prevent obesity, diabetes, and other NCDs. Governments are enacting policies like food labeling and taxes on sugary drinks to make healthy choices easier, more affordable, and more appealing to consumers. These policies aim to create a food environment that supports healthy eating and reduces the consumption of unhealthy products. Community programs from school gardens to walking groups empower people to take charge of their health, providing them with the knowledge, skills, and resources they need to make informed decisions about their well-being. These programs foster a sense of community and support, encouraging individuals to adopt healthier lifestyles. Technology is transforming care apps track health, telemedicine connects patients, and research drives new treatments, offering hope for those living with NCDs. These advancements are paving the way for more effective and personalized approaches to prevention and care. Integrating NCD prevention into primary care makes screening and management more accessible, ensuring that everyone has the opportunity to receive the care they need. This integration allows for early detection of risk factors and timely intervention, preventing the progression of NCDs. Innovation, policy, and grassroots action are all crucial, working in synergy to create a healthier world for all. These efforts are not mutually exclusive. They are interconnected and interdependent, requiring a collaborative approach to achieve lasting impact. The fight is global, but change starts locally, in our homes, schools, and communities. Every individual action, no matter how small, can contribute to a larger movement for health and well-being. Together, with unwavering determination and a shared vision of a healthier future, we can turn the tide and create a world free from the burden of NCDs. Let us work together, hand in hand, to build a brighter and healthier future for all. NCDs are a massive challenge, but they're not inevitable. Most are preventable with healthy habits and supportive policies. Start with yourself. Know your risks, get screened, and make small changes. Move more, eat better, avoid tobacco. Advocate for healthier communities. Support smoke-free spaces, safe parks, and clear food labeling. Share what you learn. Encourage friends and family to get screened and stay healthy. Every voice matters in demanding change from leaders and shaping healthier environments. Breaking the silence around NCDs is vital. Awareness saves lives. This is a marathon, not a sprint, requiring effort from all of us. Let's act now for ourselves and future generations. Together, we can build a healthier world.